Good day, Level 3 learners. Our module for today covers the physiologic disorders and nursing care in older adults. Senescence is accompanied by the decline of biological functions and the ability to adapt to metabolic stress. It is the nurse's role to assist the older adult into achieving optimum level of functioning despite these physiologic problems. General aging changes in the body are related to loss of complexity in physiologic function, such as cardiac, neurologic, and stress responses. Let us have a quick review on the physiologic changes among the older adults that you have discussed in your Module 3M. We have here the following. The cardiac output decreases and blood pressure increases, which may develop to a group of conditions in the cardiovascular system called arteriosclerosis. Please do not get confused between the terms arteriosclerosis and atherosclerosis, because arteriosclerosis is a general name for a group of conditions that cause arteries to become thick and stiff, whereas atherosclerosis is a type of arteriosclerosis that is caused by a fatty, waxy buildup called plaque in the arteries, leading to clogged arteries and reduced blood flow. The lungs may also show impaired gas exchange, a decrease in vital capacity, and slower expiratory flow rates. The creatinine clearance decreases with age, although the serum creatinine level remains relatively constant due to a proportionate age-related decrease in creatinine production. Functional changes, largely related to altered motility patterns, occur in the gastrointestinal system with senescence, and atrophic gastritis and altered hepatic drug metabolism are common in the elderly. Progressive elevation of blood glucose occurs with age on a multifactorial basis. The epidermis of the skin atrophies with age, and due to changes in collagen and elastin, the skin loses its tone and elasticity. Lean body mass declines with age, and this is primarily due to loss and atrophy of muscle cells, a term which is sarcopenia. Degenerative changes occur in many joints, and this, combined with the loss of muscle mass, inhibits elderly patients' locomotion. These changes with age have important practical implications for the clinical management of elderly patients. Metabolism is altered, changes in response to commonly used drugs make different drug dosages necessary, and there is need for rational preventive programs of diet and exercise in an effort to delay or reverse some of these changes. Following the physiologic changes that occur in the older adults, several conditions may develop on the different body systems. Changes in the integumentary system can place elderly individuals at greater risk for infection, temperature dysregulation, soft tissue injury, and longer recovery from soft tissue injuries. The value of the integumentary system is demonstrated by the high morbidity and mortality rates associated with extensive burns when all functions of the skin are greatly compromised. The overall state of health is affected by physical or emotional insults to the system. For example, loss of thermal regulation or fluid, impaired barrier protection, and other catastrophic changes in physical appearance and functioning. Structural changes in the musculoskeletal system may place aging patients at increased risk for weakness, immobility, falls, musculoskeletal injuries, and pain syndromes. Among older adults, there are several significant musculoskeletal problems that can significantly impact quality of life, such as in the condition called osteoporosis that can lead to fractures, and arthritis, which is a major source of pain among older adults, and those who experience related decreased range of motion may have joint replacement surgery. There are also several conditions and diseases related to the cardiovascular system that are common in the older adults as per the American Heart Association. You have your hypertension, coronary heart disease, which includes myocardial infarction and angina. You also have your congestive heart failure and stroke. Similar to changes in the cardiovascular system, respiratory system changes occur due to loss of tissue elasticity and blunting of responses to internal or external environmental changes. Individuals without underlying lung disease may still have issues related to pulmonary decline at the end of life. As individuals age, the smooth muscle activity and absorption may change in the gastrointestinal system. This may result in more issues with constipation, appetite, and nutritional imbalances. The elderly may also experience several major problems related to the reproductive and urinary systems. The immune system is affected by aging in multiple ways, which can increase risk of infection and delay recovery from illness. There are also several neurological disorders that are common to the elderly. That includes diseases and conditions that are often secondary to common diseases. Two of the most frequently occurring neurological diseases in the elderly are the Parkinson's disease and Alzheimer's disease. For the endocrine system, due to its complexity, determining the effects of aging on specific glands beyond atrophy and decreased secretion is difficult. Two of the most common disorders in this category among older adults are diabetes and hypothyroidism. For special senses, although many normal aging changes occur in the sensory system, most of the common abnormalities seen in the elderly are related to vision. According to Lighthouse International in 2005, a leading resource on vision impairment and visual rehabilitation, the most common age-related vision problems are cataracts, glaucoma, macular degeneration, and diabetic neuropathy. As diseases related to the senses of touch, hearing, and taste are rare. To give you the specific details of the common conditions involved in the different body systems, let us all be present and comprehend the discussions given to us by each group assigned to the different topics during the reporting. After viewing this presentation, please start making your discussion forum and group worksheet, which is due on September 17 at 8:30 a.m. If you have any questions or concerns, you may email me on the email address reflected on the instructional design, or you may raise it during our face-to-face meeting. Thank you for listening, and see you in class.